In podcast episode number 58, I talked to Jaap Wonders about lifestyle and physiotherapy. Jaap is a sports physiotherapist, manual therapist, and location manager at a practice in Leiden, Netherlands. He's also a lifestyle therapist and teaches several lifestyle-related courses. He's the author of a book about lifestyle as well. We started out by talking about the difficulty to influence lifestyle factors in our patients. According to Jaap, the biggest challenge is the environment in which we're living, which does not encourage a healthy lifestyle. Despite this difficulty, Jaap stressed that patients themselves have to be willing to change and that it's best to take small steps. Our role as therapists is to provide them with insights and to explain how their complaints might be related to their lifestyle. Next, we talked about the fact that only 1 in 4 adults and 80% of adolescents do not meet the recommended levels of activity. Jaap explained that, again, our environment prevents people to be active. People sit the whole day during transport and at work, and again when they come home to watch TV. Even if some take the bike, it's often an e-bike. Adolescents often prefer video games over being physically active. There's even evidence that professional athletes are sitting too much when they are not at training, and up to 30% of them have pre-diabetic blood sugar levels. A possible solution might be as simple as taking the stairs instead of the lift and to do some labor around the house to almost meet the minimum levels recommended by the WHO. Those movement snacks should be done every 20 to 30 minutes. We then talked about the magical number of 10,000 steps per day. Jaap explained that research shows real health benefits for up to 8,000 steps and smaller additional health benefits for up to 10,000 and 12,000 steps. At the same time, he stressed that the intensity with which you walk those steps matter as well, and the higher the intensity, the better. At last, Jaap mentioned that we should never tell our patients to stop moving completely and to just rest, but rather to perform other pain-free movements in order to speed up recovery and improve health. Our next big topic was nutrition. Jaap told us that he very much likes the guidelines from Harvard University. They recommend that half of what you eat in a day should be vegetables and fruits, with a greater share allocated to vegetables. Next, a quarter of the plate should be protein from white meat, fish, vegetables, beans, and nuts. Processed meat and red meat are not recommended anymore because they can put the body into a pro-inflammatory state, and they usually contain more fat than white meat. The fourth quarter are whole grains. Next to the whole plate, you should consume healthy plant oils and drink water, coffee, or tea. We then continued our talk and jumped to the topic of sleep. Jaap stressed that moving outside and the food you eat have a great influence on sleep duration and quality. He mentioned that he took part in a study at the University of Leiden with 877 participants, of which only 5 met the recommendations for a healthy sleep, which is 7 to 9 hours of high quality sleep. We switched back to talk about how different lifestyle factors can influence each other, and Jaap explained that he conducted a study that proved that all lifestyle factors influence each other. If you change one thing in your life for the better, it can have a positive spiraling effect on other factors as well. Another factor is stress, of course, which was our next topic. Jaap explained that meditation and mindfulness are great, but that stress management is very individual. Personally, he likes to find out what kind of stress relief suits the person in front of him by use of the DISC model, which classifies people into 4 different personality types. For some people, sitting on a cushion or being in nature does the trick, while other people prefer being active. He also explained that stress is not only negative per se, but we can also experience positive stress called eustress. Speaking about positive stress, Jaap is also a fan of cold showers in the morning. Research then also shows that cold showers release adrenaline, cortisol, and dopamine, which can give you a boost for the day. We then got into the discussion about the fact that most people know how to live a healthier life, but it's hard to do so. For me personally, having a beer on the weekend or a drink or two with friends is adding to my personal quality of life. Jaap explained that Hallmosis is a term for a biphasic response to toxins or other stressors. A small dose is generally favorable, but more has a negative health effect. So the problem is not one beer, but that one beer usually leads to 2 or 3 or more beers. The problem is also not to drink too much once or to eat unhealthy once, but to make an unhealthy habit out of it. At the end of the day, Jaap stressed that everybody has to decide for themselves how healthy they want to live. Towards the end of the podcast, we talked about chronic pain and chronic diseases and what role lifestyle can play. Jaap mentioned that there is a strong relationship between chronic disease and lifestyle factors, and that our Western lifestyle is often a culprit. The challenge is often that people with chronic pain expect a solution for their pain from us as physiotherapists, and lifestyle solutions do not really feel specific from a patient perspective. To a patient, manual therapy, a massage, or even exercises feel like a specific solution for their problem. The problem is often that people remain in an environment that made them sick in the first place, and that they keep doing what they've always been doing. So while you might be able to massage the problem away for now, it will probably come back another way. And last, we talked about 3 different layers of a patient's health problem. According to Jaap, the top layer is about a certain painful movement, about problems in the local tissue, and so on. The second, deeper layer is about a patient's general movement and about lifestyle factors such as nutrition, sleep, and so on. And the third and lowest layer are traumatic or stressful events that led to painful situations. According to Jaap, we need to explore all 3 levels in case of recurring pain, although he is aware of the fact that not all patients are open to dive that deep. Before we finished up, Jaap gave us 3 tips to improve our lifestyle immediately. Number 1 was to reflect about our own lifestyle and to make changes on a daily basis. His second tip was to perform some exercise in the morning, ideally outside, and to have a healthy breakfast. And his third tip was to keep a journal at the end of the day and to note 3 positive things you've done for your health that day. This way, you will be able to keep a positive mindset. Alright, so this was a brief summary of podcast episode 58 with Jaap Wonders. I hope I could raise your curiosity to listen to the whole episode and to learn more about lifestyle factors and physiotherapy. If you would like to have more resources on this episode, head to our website physiotutors.com, where you can download the transcript and infographic. If you want to dive even deeper into the topic, make sure to become a Physiotutors member and download our app to watch the upcoming masterclass with Jaap on the topic. Jaap also wrote a Dutch book called Alledaags Wonderlijk Leven, which you can find in the description of this video as well. And as always, thanks a lot for watching, and I'll see you in another video. Bye.